The current landscape of pandemics depends a little bit on the definition of pandemic. We are talking now about COVID-19 as a pandemic, but there are other infectious diseases of global interest that are still active, like, for instance, tuberculosis, HIV, sexually transmitted diseases, diarrheal diseases, influenza. If you want to speak about the global pandemic of obesity or diabetes, because it doesn't need to be an infectious disease. So it's a medical problem of global interest that reaches a certain level of importance. Whereas an epidemic can be very limited to a community or a country. We are not touched by some of the more tropical diseases, vector-borne diseases, which are not present over the globe at this moment, like malaria, like dengue, etc. But of course, in the future, vector-borne disease might migrate to the north, and then we will be affected by those diseases as well. I've been an HIV expert for 30 years. Of course, has some similarities, but it's also a lot of difference with the COVID pandemic, in the sense that HIV, of course, is essentially a sexually transmitted disease, and it's also a chronic disease. So it doesn't spread as quickly as COVID-19. But the behavioral changes that we have seen to prevent HIV, you can see some similarities. Because of HIV, we have learned to use a condom more systematically. Because of COVID, we are using now a face mask more systematically. The history of HIV and the success we have seen in the fight against HIV has really been a collaboration between Europe and the United States. For instance, the development of antiretroviral drugs was really a continuous exchange between Europe and the United States. I've witnessed that from very close. For instance, my own institute, the Institute of Tropical Medicine, and CDC have coordinated quite well in the Democratic Republic of Congo, in Ivory Coast and Uganda. So there are many, many examples where European and US researchers and also politicians and policymakers have collaborated quite successfully in the fight against HIV. So with COVID, of course, the world has changed, and now the virus has originated in China, and the first cases have been described there, and the Chinese, in the meantime, have made an enormous progress in science and technology. And during the first months, all the scientific publications really came from China. And still today, of course, several of the vaccines are being developed in China. And that was certainly not the case with HIV. So China has become really a prominent player also in medical sciences. It was already there, of course, but now it's visible for everybody. So with COVID-19, most European countries were taken by surprise. It's strange. There was a false sense of optimism. It happens in China like SARS, but it will not come to Europe. And then it happens in Italy and Spain, but it will probably not be as bad in Northern Europe. And that has been really a mistake. One of the first lessons, of course, is that infectious diseases are still there, and that epidemics can occur also in our countries. It's something we were forgetting. You had the Ebola epidemic, for instance. At some point it seemed to be dangerous, that it was going to come to our part of the world. It didn't happen. And then we thought maybe we are in control because we were controlling HIV, we are controlling tuberculosis, we are controlling most of the other infectious diseases. But so the first thing we should learn is there is still a threat for infectious diseases, and it can come overnight. Of course, in this case it was a zoonosis, and it's not the first zoonosis. HIV is a zoonosis, SARS was a zoonosis. So that is also a matter of concern, because where do they come from? Well, they come from either from wild animals through intermediate hosts that live in close proximity with humans, or from husbandry animals, swine, cows, chickens, because there is an enormous reservoir of potential pathogens, and especially viruses. Tuberculosis is originally a zoonosis, measles, salmonella, influenza is a zoonosis. So there, I think the lesson is that we should stop treating animals as we do today. So we should not keep so many animals anymore for meat production, and we should create sanctuaries for wild animals and not penetrate all the time. The threat for zoonosis can come under control, but then we need to change our behavior. And then you see this climate crisis, which is evolving slower, but nevertheless very fast, and nothing is really done about it. Nothing is done. And we know it is going to create huge problems. It's not difficult to predict, as I said, that some health issues like vector-borne diseases will increase, and that in an indirect way other health issues will, because of population movements, because of drought. In my country is traditionally a wet country, and now we are struggling to get enough water. And some of these problems, some of these issues can be resolved with technology, but it is going very fast and not enough measures are taken. That's really something that frightens me, not me personally, but my children, my grandchildren. And that's really frightening that our leaders are thinking on the short term and are unable to think and to act in a sustainable way for the long term. And that's really a problem with our system. It's really a problem. It will affect health, it will have consequences for pandemics, etc., but it's much broader than health alone. Of course, because we cannot master all these problems anyway, it's evident that we need better monitoring and control systems than we have today. And as I said, setting up testing and tracing capacity is certainly a lesson that we should take, and that we should keep this capacity, because it existed at some point, but then because it seemed not really needed, this capacity was gradually degraded in many countries, including my own. And you can doubt about the figures of China if you want, but I mean, the fact that Japan, Korea, Taiwan, Singapore, Hong Kong, all these countries had much less problems, the fact is that they were better prepared. And then also the question about the face masks, this has been a joke in Europe and the United States, because we are only using them since a few months now, whereas we should have used them from the start, but they were not there. And all the fake news and the conspiracy theories, that is something that we see now in the case of COVID-19. We have seen very, very similar things in the early days of HIV. There were even so-called renowned American scientists and others who were denying the fact that AIDS was a viral disease, and that has been taken over by the previous president of South Africa, which has been a complete disaster, because of that, treatment has been postponed in South Africa, and that's why the problem in South Africa is so big today for HIV. So there is certainly a threat coming from those conspiracy theories, and the line between true science, pseudoscience, speculations, fake news and conspiracy is a very thin line. And that is also a very human characteristic. If you are confronted with something new, with something threatening, something dangerous that you don't understand, well, in the case of HIV, most of those conspiracy theories and fake news has disappeared once there was a good treatment. And so that's what I'm hoping as well for COVID-19. But in the meantime, we have this vaccine hesitancy, which didn't exist so much a few decades ago. So that is another threat that could jeopardize the efforts to get COVID-19 under control. So the crisis will end at some point, and we will have, most probably we'll have a vaccine, and then maybe we will take up our quote unquote normal life with some modifications. Should be possible, and it's urgently needed, of course, because there should be a way around, and that is by being more reasonable and more efficient in using these measures. It's possible.